Hi everyone, welcome to Queen's Conversations. My name is Lucia Dragos and I'm a supervising producer at Queen's Public Television. With me are two of my production colleagues, John and Noran.
Hi, I'm John Collins. I'm a producer and director at QPTV. I'm also an instructor in the training program, and I clean up after everyone leaves.
Hi everyone, I am Noran. I am a producer and video journalist at Queen's Public Television.
Today's topic is COVID and the mental health crisis with our guest, Dr. Larry Grubler from TSINY.
Sure, thanks, Lucia. Transitional Services is a not-for-profit mental health organization. We service anybody over the age of 18 who suffers from a psychiatric disability in both residential and outpatient services. I'm Larry Grubler, I'm the CEO, and John, I clean up after everybody when they leave too, so don't feel so bad. But yeah, we've been in existence since 1975. We run the full gamut of outpatient programs, clinic, day programs, and every level of residential care in New York City.
How has COVID affected TSINY, and what were the most devastating challenges that you had to face in the past few months?
At Transitional Services, we always had a disaster plan. We had a disaster plan if there was a tornado, if there was a storm or something along those lines. We had never really talked about a pandemic. So I think like the rest of the world, it kind of hit us very quickly, and we had to take some parts of our disaster plan. We were able to go ahead and move it pretty quickly. We certainly didn't have a store of protective equipment. We had to get that very quickly. We didn't have hand sanitizer. We didn't have stockpiles of that. So we had to really put a lot of those pieces in place. Luckily, we had some of the basics down of having a command center and having individuals that were going to be in charge of certain aspects of our world if there was a disaster. So we just modified that, and that part was helpful. We also had to change the way we deliver services. So that part became much more, we had to change very quickly. So before we used to see people individually in the clinic, let's say, and they used to come in for therapy or they used to come in to see their psychiatrist. Well, with social distancing, that wasn't going to happen anymore. So we went to telehealth, and people, it was a challenge initially because not everybody has all the technology that they needed to go ahead and do telehealth. They didn't have a cell phone that you can see somebody on, or they didn't have internet. So all of those things, and I'm not even talking about those are business challenges. I'm not talking about the challenges of caring for the 4,000 consumers that we serve, because there were a lot of challenges with regulations that we had to make changes quickly and make sure that everybody was protected and safe.
You provide so many services for people and clients. One of your major offerings is housing. What kind of an impact on your housing programs does COVID have?
Well, we are an essential service, so we have congregate care level services, which are supervised settings where staff are available 24 hours a day, 7 days a week. They had to be at work 24 hours a day, 7 days a week. Those shifts had to continue. We have a source of a number of per diems that work with us as well, people that we can call in if we need assistance, staff. And they were called in to cover shifts. If anybody was sick, they needed to be covered. But we had to continue to provide those services. People that live out in the apartment treatment program or supported housing or different levels of care, they would be visited in the event of an emergency. But a lot of that was done by telephone as well. So people were checking with them twice a day to see, are you okay? Do you need anything? Do you have food? Are you able to get out to a store? I mean, it was even fascinating to think about, we were all protecting ourselves with a mask and sanitizer. We had to get masks to the clients as quickly as possible or the residents, because they had to go to the store. So without that, they couldn't go out and shop. So all of those pieces need to be put into place very quickly.
Going on with what you guys offer, not just housing, you guys also offer a wide range of residential programs in self-improvement and self-growth and meditation. Do you feel as if COVID has encouraged you guys to create more workshops, and how did you guys collaborate with everyone in the team to cope with COVID and staying indoors and the whole situation?
As I said, we had to move very quickly because we wanted to continue with the essential services that we had to our clinic. People needed to take medication. They had to come in for their medication. They needed to see their psychiatrist. They needed to go to their therapist. People were missing the social aspect of coming together in groups. Can't do that. So that part was difficult, but we had staff calling 2 or 3 times a day, each client, each resident, and saying, how are you doing? What do you need? How can you decrease your anxiety? This was very anxiety producing for everybody in the world. And if you have a psychiatric disability and you're isolated to begin with, it's that much more difficult. So we've had some challenges. For the most part, the consumers, the residents have been great and have been responsive to staff. The staff actually like, the people that have been doing the telehealth actually like it. They think that they're getting into a deeper relationship with the clients because they're calling more often.
Is there a suggestion you would give to our viewers in that sense? Because I feel as if the youth now are coping with these kind of anxiety and depression in the sense of not being able to interact with a lot of people. Is there something that you would suggest for the youth? Because many assume that the youth are coping with this because they're just on technology, but we are so used to actually being outside and communicating with one another. Do you feel as if that there's some suggestion or some advice that you would give for us or a workshop that you guys are doing to call in?
Sure, I do feel bad for the youth. I'm at a different part of my life, so dating is not exactly part of my world. My wife would be happy to know that. But even going out on a date, you can't do that really as easily anymore. So I think the suggestion would be to try as much as possible to virtually do as much as you can, reaching out to friends and family. Initially, we had a cause where we were saying, choose 10 people in your life and consistently reach out to those 10 people because it was very frustrating to be socially isolated. I mean, I've had more Zoom dinners and more Zoom cocktail hours, and reach out to family that you haven't seen or heard from in a while. It's going to take a little bit more effort, but it's definitely doable, and I recommend that for the younger population as well. I actually have children that are younger, and they do date online. And I have never met anybody that they dated online yet, but they do date online, and they have virtual dates. And it's a good way of getting to know people before you actually put yourself out there. So could be some positives to that.
Larry, you mentioned about some of the emotional and mental impact on your staff and clients, but can you go a little more into details?
Fear. I think there's a major fear and anxiety about coming to work, getting the illness, and then bringing it home to family and friends and interacting. The staff have been, I have to tell you, fantastic. We have kept all of our staff. We have not let anybody go. They have come to work every day. They've been interacting with the clients. I had one young lady that stayed with a resident that was giving birth, and she stayed with her for 39 hours in the hospital. That's the level of commitment that I have from my staff. I mean, I'm not just saying that because I'm the CEO and I want them to like me. It's truly amazing. They are out there and they're putting themselves out there. But I have to listen to their fear. And I definitely, the rest of the world is afraid as well. The clients are afraid. I did have a funny story, which I'll share with you. At the very beginning, I went over to one of the residences and I was delivering PPE, protective equipment. And a group of clients were outside on the steps. And I said, what are you guys doing? You need to be socially distant. And one of the clients who I've known for a really long time said to me, well, Larry, didn't you hear COVID doesn't affect the mentally ill? And I just burst out laughing. So you have to maintain some type of sense of humor, but yes, we had to train them on how to train the clients on how to become, stay socially distant, wear a mask, go ahead and use hand sanitizer. We have lost, I think, 12 clients, 14 clients. We have lost 2 staff members. My assistant, who many of you know over the years, has been in the hospital, still in the hospital for over 3 months. I was on a ventilator for a very long time, over 12 weeks. So it has really had an impact on us, and it is very frightening. And a lot of the information, we're trying to get the information out there clearly to people, and as comprehensively as we can, because with misinformation comes more fear. And there's a stigma to having a psychiatric disability anyway, and now you may have a stigma of having COVID, because people don't want to go near you. So it's difficult.
Did you get a lot more calls of people reaching out to you from your clients or outside and asking for help?
From the outside, yes. That was one of my major concerns. We put ourselves out there because we're continuing with services, and I wasn't sure that we were going to have the resources to go ahead and meet the needs of the people that in the Queens community or the New York City community if they reached out to us. But so far we're doing okay. We have had an increase in calls because people are anxious, they are depressed. This has had a major impact on the community.
The COVID virus has had a tremendous impact physically on our population and also on our economy. How has it affected your operating budget? Have there been impacts? And how does it affect your fundraising approaches? And what will change, if anything?
That's where I take a sigh, John, because it had an impact, a major impact on the budget, because we weren't prepared to buy all the protective equipment. We weren't prepared to buy the extra electronics that we needed to make sure that people could call in for telehealth. We weren't prepared for that wasn't part of our budget, yet we had to spend the money. And we did. We had used previous fundraising money. We applied for grants. We applied to foundations. We've gotten some money from them. Am I anxious over the long term? I am, because I don't know where the state and city are going to be with their funding. They've actually spent a tremendous amount of money, and they're talking about, they may have to cut programs by 20%. Well, we can't sustain a 20% cut when we've already spent probably 20% more of our budget on COVID-related issues. So that has been a tremendous issue for us to really monitor very, very closely. And as you know, we go ahead and we raise funds to augment what we get from the city and the state. And we have a core group of supporters who are truly wonderful to us. But we can't have our events this year because people have to stay socially distant. So we canceled everything for this year. And we're gonna resume, God willing, in 2021. Right now, we're going to be reaching out to our supporters and saying to them, we hope you can continue to support us. And this is what you did last year. Could you do something similar this year? We still need the funds. Our clients still have needs. I've always touted that we would never let a client, if I ever heard that a client went hungry or went without medication, that's what we use our fundraising money for. And the staff know that. They shouldn't be without furniture. They shouldn't be without meds. They shouldn't be without food. We have to continue that. And am I anxious? Absolutely. It's a $30 million business. You can't just keep spending money unless the money comes in from somewhere.
Do you feel as if that there is going to be a huge difference in the way that the team communicates with the clients? Is it going to be more electronically based, more Zoom meetings, more phone calls? And is it going to be a stronger connection, like you stated before, that the staff actually feels connected with the clients? Do you feel like this is actually a better improvement for how the interaction is going to be?
Yeah, my chief operating officer right now is in the process of writing all the policies and procedures for ongoing telehealth. Because we do think that is probably going to be a wave of the future. As a psychologist, you're actually trained to not only talk to the person and evaluate them, but see how they look and how their emotional responses, both physically. And so that's a little bit hard to do over the telephone. It's a little bit easier to do on Zoom or whatever platform you use. But I think that there's going to be a hybrid and a mixture. I do think that you're right, it's going to continue. It'll be very interesting. We can't get groups up and running that quickly again. It's not going to happen until the numbers go away, or maybe there's a vaccine or something along those lines. The state has to really take a look at how they fund those various services, because we can do the work. We just have to get the funding that matches the work that we're doing.
Many people are experiencing unprecedented levels of stress, anxiety, fear, isolation. At what point would you recommend that they reach out for help, and where can they go?
That's a really good question. I actually, when it starts, everybody has a certain level of anxiety, and some anxiety is okay and can motivate you and can do some positive things. When it begins to affect your functioning, when you can't sleep, you can't eat, you can't, and I wouldn't wait that long for that. But when you know that there's a problem when it begins to affect your functioning, and there are, and a lot of professionals have used these support lines to go ahead and reach out, because you're dealing, even the professionals are dealing with people that are extremely sick with something new that they really don't know that much about. So they call the support lines to get help. So everybody should use it. OMH has an emotional support helpline. It's at 1-844-863-9314. You can call our intake department and get some assistance call Melinda Tahara at 718-425-4942. I've been really touting that people should call. There's the 311, the city line. Call them, and there are people there to help. I had a COVID question the other day. I did call the hotline. I needed to know something about a staff member. We were facing issues with. I went away for 2 weeks. Now, do I have to quarantine? And I knew the answer was yes, because the governor's orders were really clear. But then there were some other issues that I wanted to go over with them, and they were very helpful. So I would recommend calling. You're going to feel a little bit of anxiety. You know what you can handle and how resilient you are. You'll also get feedback from your family members and friends as to, okay, you look really stressed, or you're more agitated than you normally are. You're yelling a little bit more than you normally are. You need to do something. And I at that point, I would recommend calling out and reaching out. I have given my phone number out to the Queens community. If they want to, they're certainly welcome to go ahead and either email me or call me. If you'd like me to do that, I certainly can do that. And then I can point people in the right direction.
And if somebody wants to donate or in any way help TSINY, where they should go?
Okay, right on our website, there's a donation button. So it's www.tsiny.org. Or they can just write out a really large check and send it to Transitional Services for New York, 10-16 162nd Street, Whitestone, New York. And just put attention Larry Grubler. I'll make sure it gets cashed.
So I see a question. Let me just go to that. What can I do to help cope? So somebody's asking what they can do as a citizen, possibly to help others, or maybe to help an organization like TSINY.
Okay, I've had people that have reached out to do things like they want to. One lady reached out to. She was making masks and she wants to deliver them. But she wanted to deliver them directly to the staff, which is perfectly fine. I can arrange that, or directly to the consumers. So depending on what people want to do, we certainly can be creative and have people can give of themselves. Sometimes I heard also, it's very interesting, I heard a commercial, and I'd like to start something like this where people would just spend 10 minutes with a client just saying, hi, how are you? And that would be kind of neat, because that would help decrease everybody's social isolation if we did that. I know I'm a fairly social person. For me to not be able to hug somebody or kiss them hello is really tough.
Next question, what can older adults and adults with disabilities do to reduce the emotional stress and anxiety? And I know you led a workshop this morning, and there were some great points in there, but specifically they're asking for adults and adults with disabilities.
Sure. Well, what we're recommending is that people have a routine, try to stick to that routine as much as possible, to try to get as much exercise as they can. The gyms aren't open, but that doesn't prevent you from going outside, wearing a mask, taking a walk, keeping socially distant, getting enough sleep, getting enough rest, really not sleep. A lot of people were home. I have friends that work from home and they're taking a nap during the day, and then they're not able to sleep at night, and they can't figure out, well, why is that different? Well, it's different. When they were at work, they weren't sleeping. So now they're home and they're taking a nap, and now they're not sleeping all night. Find a hobby or something that you enjoy doing and make plans around that. I've had staff send me pictures of their gardens, that they've been really working on their gardens, they're working on their plants, reading books. Find something that you enjoy. I do recommend, and this occurred this morning as well, not listening to the news 24 hours a day, 7 days a week. That can be very distressing, and people can get very wrapped up in that. We have a lot going on in the world right now beyond COVID, and it's hard. It's really difficult. But there are things people can do that can cope. One of the things that we talked about this morning was animals and pet therapy, and on that QPTV, the Queen's Chamber of Commerce presentation. And I mean, I'm very lucky. I have 2 dogs. They were my saving grace. And I took them to work every day, and I talked to them a lot. So they were great. They were great, and animals do help.
A pandemic of this nature is going to put tremendous pressure on facilities, on health and protective services. What's going to happen to insurance, and what do you see from the government side that's either good or bad about it?
Well, that's the part I was talking about that makes me a little anxious, because there's a lot of talk about the government, without the federal bailout to the states, the state government and the city governments are not going to have the money to go ahead and continue with funding programs to the level that they were funding them. And as I've talked about in the past, they've been underfunded all these years. So now we're going to go ahead and have a decreased possible amount of funding that's coming from the government. And that's starting to hit in some of the counties around New York State. Upwards of 20% of their funding has been cut. It hasn't happened downstate as far as I know yet, or at least that I got in my emails today. But it would have a major impact. We rent hundreds of apartments. I can't turn to a landlord and say my funding was cut, I'm going to give you 20% less on the rent than I already agreed to give you, or tell 20% of my clients that they can no longer live with us. It's not going to work that way. So that part of, we're constantly on top of it, and the insurance, there were a lot of sick people. I mean, the insurance rates are going to have to go up to cover those losses. Insurance is next to payroll, is our health insurance is our largest cost next to payroll. This year we did okay. I didn't have to pass on those costs to staff. Next year I'm worried, because somebody's going to catch up to say, you spent millions of dollars for people that were in the hospital or sick or on COVID tests or on the antibody tests or whatever. Or as you say, people in the hospital. Somebody's got to pay for that. Can't keep passing that along to staff. You can't make $30,000, $40,000 a year and then pay most of that for your health insurance. You won't have money to live.
And premiums will have to go up, obviously.
Premiums are going to go up. Somebody's going to have to pay for it. And I try to be so protective of the staff so that we don't lay those costs off on the staff. And you know, there's always a copay, there's always a donation or contribution to it, but we're not talking about people in the mental health field that earn a tremendous amount of money. So to constantly ask them to go ahead and contribute to that just doesn't work.
Thank you. I mean, I think that's all from us today. Larry, if you want to add something before we close.
Thank you for giving me this opportunity. I truly appreciate it. I want to let everybody know that we are here for the Queens community. If anybody wants to reach out to Melinda at 718-425-4942. If I said anything profound that you feel like you need to reach out to me, please do. You can reach me at lgrubler@tsiny.org or call me on my phone at 718-746-6647. Use extension 7011. I'd be more than happy to talk to you and lead you in the right direction.
Larry, thank you so much. And for those of you that are watching, thank you so much as well. We'll see you next Thursday again at 3 p.m. On Queen's Conversations.
Thanks.
So bye for now.
Bye. Stay well.
All right, I will clean up after everyone leaves.